Did you know that not everyone should consume garlic, despite its widespread use and many health advantages? In this video, we'll discuss 8 typical adverse effects of garlic and explain why. If you have certain medical conditions or are on certain medications, you should avoid eating it. By the time this video ends, you'll know exactly when it's preferable to use substitute items and when you should eat garlic for health advantages. In certain situations, we will also address the appropriate dosage and provide some answers. This will be a really useful and educational video. So click like and let's get started if you want to take control of your health. Number 1. Gastroesophageal reflux disease. Garlic can exacerbate symptoms of gastroesophageal reflux disease, GERD, also known as reflux disease, and should be avoided by certain individuals. These symptoms include acid reflux and heartburn. Garlic may cause discomfort or exacerbate existing symptoms in certain people. In such circumstances, stay away from it or take modest doses. Garlic's impact on GERD symptoms can also vary depending on how it is eaten. GERD symptoms may be more likely to occur from raw, powdered, or supplemented garlic than from cooked or processed garlic. Cooking garlic can lessen its strength and lessen the likelihood that it will exacerbate acid reflux. The degree of a person's intolerance to garlic varies widely, and some people may discover that tiny amounts of garlic do not negatively impact their GERD symptoms. Number 2. Blood-thinning medications. Garlic users who are using blood thinners should also use caution. Although blood thinning is typically good for many patients with obesity, diabetes, and other conditions, garlic has blood-thinning properties that can interfere with the effectiveness of blood-thinning drugs like warfarin, aspirin, or other anticoagulants. You could get bruises or bleeding if you take these drugs with garlic at the same time. Garlic consumption should be reduced or stopped for a while if you use blood thinners and discover that you bruise easily. You should also monitor any changes that occur. Number 3. Digestive problems. Individuals who have digestive issues ought to be cautious about how much garlic they eat, due to its high fructose and sulfur content, which can induce gas, bloating in the abdomen, and diarrhea in some cases. Garlic is avoided for the second most prevalent reason, especially when ingested on an empty stomach. Eating it with meals, and maybe after a snack, is one easy way to solve this issue. Steer clear of supplementing with garlic in the morning. Always pay attention to your body's signals, and see a doctor if you have any worries or suffer any unfavorable consequences from eating garlic. It's critical to determine what best suits your unique requirements. Number 4. People with certain medical conditions. Those with certain medical conditions, such as hypoglycemia, low blood sugar, or low blood pressure, should take caution when eating garlic. Garlic may have a hypotensive effect, meaning that it decreases blood pressure. It is believed that allicin, among other things, has this effect because it relaxes blood vessels and promotes vasodilation. Although the hypotensive effect of garlic can be beneficial for those with hypertension or high blood pressure, it can be hazardous for those who already have low blood pressure, especially when taken in high amounts or in concentrated forms like supplements. It could make you dizzy and even make you faint. For those who already have hypoglycemia, garlic can dramatically lower blood sugar levels, which can cause symptoms like weakness, disorientation, sweating, trembling, or fainting. Number 5. Patients with certain autoimmune diseases. Patients suffering from specific autoimmune disorders. The prevalence of autoimmune diseases in modern society is beginning to be recognized. Many patients receive a diagnosis, which sets them on an arduous journey. According to certain research, garlic may boost immune function, making autoimmune illnesses like multiple sclerosis, lupus, and rheumatoid arthritis worse. These folks might want to speak with their doctor before regularly ingesting garlic. Number 6. Persons with sulfur intolerance. Those who are intolerant to sulfur. Those who are sensitive to or have a sulfur intolerance may experience negative effects from the sulfur compounds in garlic. Skin rashes, headaches, and stomach discomfort are possible symptoms. Garlic may be best avoided by those who have these symptoms after eating it. Number 7. In people with kidney stones. Garlic includes oxalates, which are naturally occurring substances present in a variety of plant diets that are associated with kidney stones. One of the main ingredients of kidney stones, calcium oxalate, is known to be formed when oxalates bind to calcium in the body. Garlic adds to the dietary intake of oxalates, even though it is not one of the foods with the greatest concentrations, particularly when ingested in large quantities or in concentrated forms like supplements. In order to lower their risk of kidney stone formation, people with a history of the condition, particularly those who are predisposed to calcium oxalate stone formation, may need to limit their consumption of foods high in oxalate, such as garlic. Number 8. In nursing mothers. There is an additional group of people who should only avoid consuming garlic after adhering to these. We are going to talk about problems pertaining to breastfeeding moms. You might be surprised to hear that garlic can sometimes change the flavor of breast milk. This may lead to fussiness or refusal to eat in certain babies. Even while it's generally considered safe to consume modest amounts of garlic while breastfeeding, if your baby starts refusing to drink your milk, you may want to give up on garlic for a